Welcome back. We are answering your coronavirus and vaccine questions with Cone Health's Chief Pharmacy Resident, Dr. Amy Thompson. Remember, you can always text your question. The number is at the bottom of the screen, but this is a text only, so please don't call. All right, already in the lineup, this person is asking, do you have to be a Guilford County resident to get vaccinated for COVID in Guilford County at the health department or at Cone Health?
No, you do not. At Cone Health, you can make an appointment online and you don't have to be a resident of Guilford County. We will take anyone as long as you can get in to have an appointment.
All right, this person says, why would you open it up for level 2 for age 65 if I'm still waiting for an appointment and I'm 84?
Yeah, I can kind of sense there's some frustration there. I understand where they're coming from. You know, we really have to increase the rate that we're vaccinating people. And so that means that we need to open it up to a larger pool of people. I would say to anyone out there, if you can't get an appointment, you don't need to panic. We'll get to you. We're right here with you, and knowing that you want to get vaccinated, it will get to you. We just ask for your patience.
Yeah. And this is one of those things where, you know, there's a lot of moving parts in all of this. And the fact that we were able to vaccinate 1,000 people today is really great. And there are going to be vaccines for you. Okay, this person is saying, does it cost anything to get a COVID vaccine?
No, it does not cost anything. There is no cost to you. If you have insurance, we'll take your insurance, but you do not even have to have insurance.
This is a very common question. It says, can you get your COVID vaccine at your primary care physician's office? And if not, why not?
So right now, you cannot. The way that we have had our vaccine allocated by the state is that they go for those really large healthcare systems and the places that can vaccinate tons of people really quickly. So I think eventually we'll get to the point where you could get it at your provider's office. But for right now, they're not available at your doctor's office or your smaller clinics.
Mm-hmm. This person is asking, is the Coliseum location equipped for those with limited abilities for walking?
Yes, that is a fantastic question. So we have a drop-off point where someone who's in a vehicle, if they have someone that they need to get up to the door really quickly, you can just drop them off and circle around and park the car. We have tons of wheelchairs here. We have lots of assistants. We have chairs everywhere if you need to sit down while you're waiting. There is no need for you to be afraid of getting the vaccine just because you're afraid of kind of not being able to get into the building and kind of walk around.
This person is asking, will Cone Health or Guilford County keep trying to get more vaccines each week so that they can vaccinate more and more?
Yes, that's another great question. So the more that we vaccinate, the more vaccinations that we give. And so the more that we get, excuse me. And so it is really in our best interest to vaccinate very, very quickly, and we will get more and more vaccine from the state. I'm not worried about us running out. We will get more. We'll get to everyone eventually.
What does it mean if I don't get the second vaccine? This person is asking.
So there were some people in the trials, both the Pfizer and the Moderna, that only got one. And we know that there is some effectiveness if you just get one vaccination. But really to maximize and get the real true benefit out of the vaccine, we would like for you to get the second one. If for some reason you cannot, getting the first one is better than getting nothing at all.
Mm-hmm. This person is asking, which manufacturer's vaccine are we getting through Cone Health? Is it the Moderna or the Pfizer?
The Moderna has a little bit of an easier time with us holding it in our storage area because the requirements for storage are a little bit different. And so we like to reserve that supply of Moderna for some of our more rural sites. At our Greensboro Coliseum location, we have the Pfizer, and most of the Cone sites will be Pfizer, but we do have some Moderna that we sometimes give at some of the locations.
All right, this person is saying, I don't have the internet. Is there another way I can get an appointment? And maybe not at Cone, but definitely through the health department.
Yeah, definitely through the health department. They have a phone line that's set up. Through Cone right now, we have the appointments that are online. So if you can get someone to help you with getting that access online. But just because you don't have the internet doesn't mean that you can't get it. It's just that we don't have our phone line set up right now.
Mm-hmm. And that has been an issue for many health departments and things as they try to open up phone lines and have those phone lines crash because the need is so much. So the internet seems to be kind of the easiest way to get the biggest amount of people at the moment. But of course, we've learned a lot of things over the last couple of months, haven't we? All right, this person is saying, will having the shingles affect me getting the vaccine?
I wonder if this person is asking about this shingles vaccine. Maybe. So if it's the shingles vaccine, we'd like for you to separate your shingles vaccination from your COVID vaccination by 14 days. So there's a little bit of a timing that comes into play there where you shouldn't get both vaccinations right back to back. So separate them by 14 days. If it's actually shingles, I would ask for you to talk to your doctor about whether they think that it's best for you to get it right now, just because of your medical history and kind of what's going on in the background.
Okay. Just real quick, kind words from a viewer. They said the vaccinations today at the Coliseum went very smoothly and all the people were superb, got the second appointment on the spot. So awesome. That is always good to hear. We're going to take a quick break and we are going to continue to answer your questions. Remember, you can text us those questions, 336-379-5775. We'll be right back.